Good morning, Uveka, and good morning to the viewers out there. Indeed, I did visit Northwest, especially Mahikeng, on Monday. That is 2 days ago, because we had just asked the South African Military Health Services to help, because there were two main problems that we experienced in Northwest. The first one was that the medical depot, that is the warehouse that supplies all the hospitals and all the clinics with pharmaceuticals, surgical sundries and other health commodities, was completely closed down due to the strike, so that even hospitals and clinics that were not affected by the strike could not work because they had no pharmaceuticals. So we were going there to inspect or see how the army is helping. And indeed, we found that part of the problem was that even the private security company that was hired to guard the depot were part of this close down of not allowing medicines out of the depot. So we got rid of that company, and the SADF took over. And so the process of supplying medicines to clinics had commenced when I left. The second problem was that there was dysfunctionality in the main hospital in Mahikeng, the provincial hospital called Mahikeng. So the army has also deployed 57 nurses and doctors there to take over the hospital and make sure that there are operations.
All right, so since your visit...
unfortunately...
Sorry, do go on, Dr. Motsoaledi.
Yes, but unfortunately, the strike seems to be expanding to other parts of the province. Like right inside Mahikeng, I visited the biggest community health center, which sees 7,000 patients per day, and it was closed down. The nurses are not on strike, but they are fearful for their life because they say they come very early in the morning and see only chronic patients, patients who are on ARVs, who are on TB treatment, diabetes, hypertension. They see them in the morning and run away. And even the patients themselves, only 30 came, whereas every day they see about 200 patients. When I asked the nurses, they said, those who were there, the managers, they said the nurses are determined to come, but they are fearful of their lives because they are even phoned at home never to come to work. A few patients they know who usually take their medicines there, when they phoned them and said, we have not seen you coming to collect your medicine, the patient also said they've been warned not to go nearer the clinics because their lives are in danger. So you have got both nurses and patients not going to the clinic because they are all scared for their life. So it becomes a very serious crisis for us in that regard. In one of the hospitals, I think it's Lihurute Hospital in Zirast, was totally closed down. That is the hospital where some people stormed into the wards, especially the neonatal ward, find newborn babies and chased away the nurses that were taking care of them and left the babies alone. We had to rush in and take the babies out.
Dr. Motsoaledi, sorry to interrupt you, but since your visit then on Monday, would you call this a crisis now? Because when I spoke to your health MEC in the province on Friday, he didn't seem to think that it had reached crisis proportions at that point. He seemed to think that the situation was more or less under control. Has that status changed since your visit? Because you used the word crisis just now.
Well, I'm not sure which aspect he was talking about. As I said, the biggest crisis was the non-delivery of medicine. And since we have secured that biggest crisis we have avoided. But the fact that some clinics and hospitals are still closed and not working, to me, it is a problem. Anyway, I'm going back there tomorrow. I'll have to assess that since Monday when I was there, what changes have taken place. All
right, so this strike or this go slow actually began about 2 months ago. The doctors there having written an open letter, about 73 of them, they've asked for urgent help. It seems they are pleading for help, Dr. Motsoaledi. In the past 2 months, what has been done about the situation? You went there on Monday, but what had been done about it? What had you been communicating? Who had you been communicating with about this, if at all, over the past 2 months before these protests actually began last week?
Well, Uveka, the protest, the Nehawi strike in particular started on the 28th of February. You will realize that on the 2nd, that is 3 days after it started, I was already in Northwest, in Mahikeng, because the strike at that time, as far as I know, was around the issue of Midiosa, where NEHAWU members said they've downed tools in the provincial government. That means it was the administrative staff. They've downed tools because they were owed their performance bonuses. Their performance bonuses were not paid because the department said they had no money. But then the workers said at the same time, they paid 30 million rand in advance to a mobile clinic company called Midiosa. So I went there to see that, because that's exactly what they said had caused the strike. And I did meet NEHAWU members in Ratlo, 100 kilometers west of Mahikeng. And they told me exactly the same thing. And I inspected the Midiosa and I found that in fact it was bad and it's not even needed. You know, I was in a press conference. I announced what I thought needed to be done at that time. And then I discussed with the province on how to solve some of the problems. From there, there have been several meetings behind closed doors to try and resolve this issue. Like last week, Monday, I met with the national executive of NEHAWU to try and discuss these issues. The DG, Director General of Health, has been meeting with stakeholders, including the provincial executive, for quite some time now.
Okay, so it seems that that crisis and that situation has been compounded by what is happening now for the past week or so in the Northwest. Dr. Motsoaledi, what do you do now?
Precisely, Uveka, because I've told you on the 28th how the strike started, what were the grievances, but they kept on expanding. They kept on being added, one of them being that the HOD must leave. I reminded NEHAWU that that call about the HOD was first made by me, actually, if you remember, on the 2nd of March when I went there, because after assessing the situation, I realized that where some of the problems were emanating. Now, at the present moment, yes, our biggest problem is how to make the health services function, how to make them stay open. And that's why we ask the South African Military Health Services to help. And as I've told you, securing the depot means the areas that are not affected will be able to function normally because they'll get their supplies. But also the areas where, like Mahikeng Hospital, where there are no, where the workers have run away out of fear of their lives, that the army will take over and work there. We have just written a letter to the army to see if they cannot extend this to other health centers where they are affected.
Well, the doctors, Dr. Motsoaledi, are warning that this could be worse than life is Esidimeni. Can you give your assurance that it won't reach that proportion?
Just come again?
The doctors are warning that the situation there at the moment could be worse than the Life Esidimeni tragedy. Are you convinced that you can avert such a crisis, such a tragedy here?
Well, it has become fashionable, Uveka, since Life Esidimeni, that every problem that happens, people liken it to Life Esidimeni. It's becoming fashionable in South Africa. It's quite unfortunate because it looks like the whole health department, single thing that happened is now based on Life Esidimeni. I do not know what they are talking about, if I understand exactly how Life Esidimeni happened and what did happen there. From where I was on Tuesday, I did not see anything like that. If it so happened that there's a big disaster there, it will be a disaster of its own, and it can't be Life Esidimeni. Because you know very well, you are listening to the Judge Mosenega arbitration.
Well, I actually think that they're just likening the proportion of the crisis, Dr. Motsoaledi. They're likening the situation. They're talking about being able to serve people and give people the help that they actually need, those in need. Like you say yourself, health workers are unable. They're too terrified to get to work. Patients themselves are terrified to go to get the medication and the treatment that they need. I think they're talking about it in that way. So let me rephrase that. Do you think that this is going to become life-threatening?
Well, look, that thing is a strike. People are burning things all over the place. They get into hospitals. I gave you an example of Luhurutso Hospital, where adult human beings get into a ward where newborn babies are being taken care of and chase away the workers. I mean, that is savagery. So I cannot control such savagery, because when the people you can talk to are unions, and the unions said they are not responsible for that. I speaking to NEHAWU, they reject the fact that they are intimidating anybody, that they've chased anybody away. So there is also a lot of thuggery, and because you don't know who the thugs are, I cannot sit here and predict and say this is how things will go. Unfortunately, I'm unable to do that.
But you will do your best to see that people get the treatment they need.
Of course, that's what I go there for all the time. On Monday, I was there for that. Tomorrow, I'm going there for that. That's the best I can do. But as to how to predict what will be banned and how the uprisings will go, I'm not sure whether even police intelligence know that, because we can then only rely on them.
All right, thanks very much for your time. That's Health Minister Dr. Aaron Motsoaledi. He's in our Cape Town studios for us this morning.